Before we brought the Ricoh order management solution into Grey Bruce Health Services, we operated entirely on a paper system. We do order entry for anywhere from 3 to 12 hospitals at a given time, so just managing that paper system was becoming overwhelming. We were getting to the point where our workload was exceeding our human resources, so if we didn't make a decision and have a plan in place to be able to handle the additional workload that we were seeing with the number of orders, we were going to have to start adding staff or radically changing the roles of individual staff. Ricoh was one of several companies that we approached to provide an order management solution. Ricoh was the one company that stood out front in the ability to turn around our requirements very quickly, at the same time offering us a solution that we needed. The pharmacy side, it's changed radically. We can have pharmacy technicians jump in and out of the order management workflows really seamlessly, and we can also have the pharmacist verification of those medication orders happen from pretty much any location that we can stand up even a simple computer like a laptop. Start talking about 1,000 orders a day, even saving 30-40 seconds per order is a huge impact. One of the frustrations the pharmacists in particular were noticing is that they were getting tied to the entry and verification of medication orders, and that was done down in our central pharmacy. And they wanted to get back up into the clinical areas, realizing that they could have more input at the front end of an order. The interactions between the physicians and the pharmacists are much easier, is probably the best way to put it.
When I'm verifying orders, so it's really nice to have both things. I can look up all the patient info and see the order at the same time. Because it's paperless, you could retrieve all your info within a second. Like there's no digging of papers or any of that, so the documentation and retrieving info is really helpful.
Anytime somebody calls me, and we do get those calls amongst pharmacy leadership quite frequently, a system that you have to force workflows into, it was able to literally slide into our workflow, but it also allowed us to improve those workflows along the way. DocuScripts was extremely flexible at offering both fitting into an existing workflow and modifying workflows to a more efficient model. My direct supervisor has certainly recognized that we were able to maintain our increasing workload, that there's potential to it outside of just strictly managing the medication orders. We're focused on providing the best patient care within resources that we have available to us. I would have no problem recommending Ricoh as a solution, and I haven't second-guessed any of the decisions we made.